Alrighty. This one's just a little quick short video, but this is just other medications or other agents that can help treat heart failure. So vasodilators, we know that they lower the blood pressure, and that the drugs are hydralazine and isosorbide. So if you ever see those two drugs, just think like vasodilate, like don't even like which one is it, one of these. No, like just think of hydralazine and isosorbide as a vasodilator, and it lowers blood pressure. Even if it's like, depending on the question, literally just be like lower blood pressure, because most of these like don't even increase blood pressure. But anyways, then we have ACE inhibitors, which blocks angiotensin and it decreases the blood pressure, which is also probably another vasodilation, you know. And then you have lisinopril and then enalapril. So ACE inhibitors, lisinopril and enalapril. Lisinopril and enalapril. And then And then you also want to watch for a dry cough. So remember what Dr. Anderson was saying. She was saying like, oh, they usually have a dry cough all the time. And then you also want to check for high potassium. So make sure that they don't have hyperkalemia. And you also want to check for the decrease in blood pressure, because that's what it does. And then you have your ARBs, which is your angiotensin 2 receptor blockers. And they're like ACE inhibitors, but they just don't have a cough. So if they're like ACE inhibitors, and they decrease the blood pressure and they increase potassium. So you want to watch for a high potassium. And those consist of losartan. So sartan. So think of Spartan with the ARBs, or ARBs are Spartans, sartans. So losartan, valsartan. But really just focus on losartan or just sartan, you know? And they don't have a cough, like I said. And then for diuretics, we know that this gets rid of fluids. So you have your thiazides, which is your hydrochlorothiazide. Then you have your loop diuretics, which is your famous one, the furosemide. We see that a lot in ATI because it's stronger and most probably commonly used. And you want to watch for their potassium because it might increase it. And then you have potassium sparing, which is the spironolactone. You want to also watch for potassium because why? It's in the name, potassium sparing. So it spares potassium. So it can cause hyperkalemia, possibly. Then over here, we have beta blockers. We know beta blockers, when we took that test, it decreases the heart rate. So they'll, just a little review, beta blockers, they decrease the heart rate and they cause vasodilation. Yes, vasodilation. And then they have metoprolol and carvedilol, but the main one that we know and we might see is metoprolol. Maybe carvedilol, but metoprolol. And then we want to watch for you want to watch for a low heart rate, right? Because that's what beta blockers do, and dizziness. And then we have two new ones that I don't know, but it's Neseritide. It mimics BNP, the hormone. So if you remember from the last video how I wrote down how to test for heart failure is through a BNP test, an ANP test, and I believe that's the only two. So we know with the BNP, that one should be, if it's the desired level, it should be less than 100. You have a positive heart failure if it's greater than 100. ANP is the 22 to 77. So it mimics the BNP hormone. I'm probably going to search that up on my own. I'm not going to say anything about it because I don't know. I don't think it's important. But, shoot. It treats acute heart failure, right? So it treats acute heart failure. It can cause vasodilation and fluid loss. And then you want to watch for low blood pressure in kidneys. I think it's because the way it goes through. And then you have the last one, Vericiguat. It helps the heart pump in chronic heart failure. So I think this is like a good one for that contractility. So it helps the heart pump and whatnot. And then you also want to watch for a decrease in blood pressure and anemia. And that's it. Those are just the other agents. I got this from the slide and ChatGPT and stuff.